everyone. A very warm welcome to today's webinar on digitization of contraception services in India. At the outset, I thank immensely the President, Dr. Alpesh Gandhi. He will take a few more minutes to join. I thank him for sourcing us this webinar so that we can launch this particular product, Ask Tanu, which is going to help our clients immensely to obtain knowledge about contraception online. As the event unfolds today, I hope the audience will become well versed with what this Ask Tanu is about. It is a chatbot. And we also have an esteemed speaker from Pune Ops and Gynae Society, Dr. Dilip Walke. Let me begin by introducing the chairpersons of today, Dr. Atul Ganatra, the Vice President 2020, and also the Vice President for my committee, and Dr. Jaydeep Tang, the Secretary General of FOXI. I have the pleasure of introducing both the chairpersons. Dr. Atul Ganatra is the current Vice President, as I said. He has been the chairperson MTP Committee FOXI 2012 to 2014, a treasurer IAGE as well, member managing committee MOX, medical advisory committee FPAI, director of his own unit, Ganatra Nursing Home, consulting ops and gynae endoscopist at many hospitals at Mumbai, with over 20 years of experience in OB-GYN. His area of experience includes laparoscopic surgery, IVF, and high-risk pregnancies. He has had several research papers to his credit. Of note are the 7 international research papers. I welcome you, Dr. Ganatra, and shortly you will be introducing the vice presidents, other 4 vice presidents. I have had the pleasure of inviting them, and they have graciously accepted to be with us today. I shall go on and introduce the Secretary General, Dr. Jaydeep Tang, the industrious personality of FOXI, and I am so thankful that he has been able to join us today, even though we are few hours from the very busy managing committee meeting which starts tomorrow morning. Can I have Dr. Jaydeep CV, please? Can I have his CV?
Yeah, ma'am. Just a sec.
SCG, please be ready with the flow.
Yeah.
Yes, I think it will not be an overstatement to say that Dr. Jaydeep has been well known to Foxians for many years, many decades now. Yes, please. Yeah. So he is also the immediate past president of Mumbai Ops and Gynae Society. Last year was a very eventful year under his leadership at the society. His chair, International Federation of Ops and Gynae, FIGO, Committee for Safe Abortion. He is also the deputy secretary for AOFOG. He is the ex-chair for Publication and Newsletter Committee, AOFOG. Reproductive Endocrinology and Infertility Committee, AOFOG. He has been the chair MTP Committee 2004 to 2009, and I think he really set an example for many other chairpersons to follow. Vice President for Forum for Enhancement of Quality in Healthcare, FEQH, and this is a very important international forum. Consultant at his own unit, Ashwini Maternity and Surgical Hospital. Program Director and Member Board of ProFert IVF, visiting consultant for IVF at 15 IVF centers. Well, he has considerable constitutional abilities and instrumental in drafting the proposal for FIGO, has resulted in a very, very lucrative project in terms of huge public health impact, and technical lead for the project also. And on a 6-country project on menstrual hygiene, he is working on developing a proposal for that. Also working on developing a project for MOX geared towards assisting underprivileged women in urban slums and more such work. We welcome you, Dr. Jaydeep. Thank you very much for joining, and thank you for being there in the advisory board meeting which we had with our industry partner Bayer when this chatbot was being discussed for being launched, and we'll take your expert inputs on the same. Thank you and welcome. I now request Dr. Ganatra to welcome the other four vice presidents, the ladies, and Dr. Tank to then invite Dr. Dilip Walke to deliver his talk.
Thank you, Dr. Shobha Gudi.
Yeah, thank you.
Thank you, Dr. Shobha Gudi, for giving us this opportunity. Jaydeep and myself. Jaydeep is a very, very dear friend, and of course, the Secretary General. It's an honor to introduce my co-vice president, Dr. Anita Singh, ex-professor, Patna Medical College, past president, POGS, vice president, Foxy this year with me, chairperson, Endocrinology Committee 2014 to 16, member, Governing Council of ICOG 2015 to 2020, Chief Consultant, JP Hospital, Patna, Organizing Chairperson, Yuva Foxy 2011, Organizing Secretary, AICOG Patna, Organizing Chairperson, ICCOB Patna 2017, contributed many chapters in books and many, many articles in national journals. Welcome, Dr. Anita Singh. Great to have you here. Dr. Ragini Agarwal from North India, a very famous personality, founder, Gurgaon Society. I still remember my days of Manesar when I went to Gurgaon. Founder President, Haryana OBGYN Society, President-elect, Aesthetic and Regenerative Society, President, Indian Academy of Dermatology and Cosmetic Dermatology and Gynecology, Founder President, Haryana Association of Gynae Endoscopy, Founder Chairperson, IAG Haryana Chapter. She started a lot of new associations. Founder, National Founder Chair, Aesthetic Health Committee, Indian Menopause Society, Founder Chapter Secretary of IMS Gurgaon, Patron Gurgaon Menopause Society. That's great, Ragini. Good to have you here. Dr. Ramani Devi, another very, very enterprising vice president. Again, in my year, I think I'm very lucky to have such lovely vice presidents with me. Managing Director, Ramakrishna Medical Center, won 10 gold medals in UG and PG, winner of the Professor Don's Prize, Chairperson, Endometriosis Committee, Woman of the Year Award, Bharati Darshan University, Women Achievers Award by Citizens of Trichy, member of Consensus on Endometriosis in the Asia Pacific region. She received the APJ Abdul Kalam Award in 2016. I think I can go on, and I'll go on to the last one. I think International Advisory Board Member, Society of Endometriosis Society of Bangladesh. Dr. Ramani Devi, that's a brilliant CV. Welcome. Dr. Archana Baser, who's right now on the hot seat, will probably be organizing the next AICOG whenever it happens. Consultant OBGYN, Director of Akash Hospital, Indore, Guinness World Book holder for the removal of the largest uterine tumor, Organizing Secretary, as I said, AICOG 2021, Indore, Fellow Representative, AICC RCOG West Zone, Imaging Science Committee Chair, Suffolk, past positions, Chairperson, Fox Imaging Science Committee 2015 to 17, Organizing Secretary of ISAR 2016, Member Managing Committee of ISAR, IAG, and ICOG. Welcome, Dr. Archana Baser. Great to have you here.
Thank you.
I think we'll go on to the next. Dr. Alpesh hasn't joined us yet. Yes, again, the next, please. Jaydeep, your call.
Thank you very much.
Yeah.
Yes, thank you. And it's my pleasure first to be present at this webinar where all of our vice presidents, our wonderful, dynamic, enthusiastic, and enterprising vice presidents are all there together. I'm sure we'll be seeing more of each other over the next couple of days with all the Foxy meetings, but it's always a pleasure. And I must appreciate and thank all of you for being so nice and so cooperative throughout the year, and more importantly, being so enthusiastic and hardworking throughout the year. It is now my pleasure to introduce my dear friend, Dr. Dilip Walke, Dilip was the president of the Pune OBGYN Society, and I had the rare honor of being the chief guest for the Pune annual conference when he presided over that annual conference. Thank you very much for that, Dilip. He is the consultant of the MediPoint Hospital and Jupiter Hospital, Pune. He was very able chair of the Ethics and Medical Legal Committee in Foxy from 07 to 10. And he's an advisory board member and investor in Dr. Prax, the telemedicine app. But what this CV doesn't tell you, and I don't think what words can convey, is the passion and the right-mindedness of Dr. Dilip Balke. He is one of the most straightforward, forthright persons I know, and he is so passionate about everything that he believes in. It's always a pleasure to listen to him and talk to him. So the stage is all yours now, Dilip. Thank you for being here.
Thank you very much, Jaydeep. Shall I start? I cannot start. The screen says that I cannot share the screen. So will somebody allow that?
Gayatri.
Javed?
Yeah, Gayatri, can you do this immediately?
Can you see my screen now?
Yes, sir. Yes, sir.
Yeah. Shall I get started then?
Yes, Dilip.
Okay. So thank you very much. I bring you greetings from Pune, and I must start by saying thanks to Shobha and Alpesh, and thanks to all my friends, Atul, Jaydeep, and everybody. It's very nice to get connected to all of you. Though I would love to meet you all in person someday when this pandemic gets over. So we all thought that in 2020 is going to be a challenge for Alpesh, but thanks to the wonderful team of vice presidents and people like Jaydeep Dang, they created opportunity even in this pandemic situation, and opportunity called Ask Tanu is going to get started today. So I'm really proud to have such a team at the helm of the affairs in Foxy. As a common member, I am really proud to have you all as the team members. Whenever anybody talks about telemedicine, and today the talk is going to be on telemedicine for contraceptive practice, no sooner than this topic is announced, the immediate reaction is nahi, because now there have been so many webinars by so many associations and so many pharmaceutical companies on telemedicine that we people have become bored of listening to telemedicine as a topic. So what I'm going to do today is my approach to this talk today will be with a special reference to contraception practice in, especially in private setup. I'll have a look at several frequently asked questions on telemedicine in general and on its legalities in particular. Then we will look at some practical tips and tricks when it comes to doing our contraception practice. And then we'll, at the last slide, maybe if time permits, we will talk a little more on that, how to use the private platform providers, how to use the private platform in a smart way. So this whole presentation is going to be in a rapid fire form, because there is no point in wasting time in explanation of every point, because everything is there in the telemedicine practice guideline. So the questions that come to our mind whenever somebody is talking about telemedicine: is this telemedicine going to be allowed only during this pandemic, or is it going to be allowed beyond the pandemic too? And the answer is yes, it is here come to stay, is going to be allowed henceforth forever. Are we expected to clear some certificate course? Yes, actually. But at this moment of time, the course has not started. The course is going to start after 3 years. So at this moment of time, everybody sitting here, everybody who's joined this webinar is allowed to practice. And even the Ayush doctors are allowed to practice their own pathies on telemedicine. Are we allowed to charge for our consultation? Yes, we are allowed to charge for our consultation. Are we allowed to tie up with private platform providers? Yes, we are allowed to. But this next point is very important. We are not allowed to solicit patients by using patient acquisition models by these private platform providers. So if somebody comes to you and says that you pay us so many rupees and we will put your name on the website and then you will get more patients, be aware of it. And be aware of this, because now MCI is out and NMC is coming in. The news came just yesterday. So things are going to be difficult from tomorrow. Is it safe to give contraceptive advice on telemedicine platform? This is the main question that we want to address today. And the answer is yes, it is safe, because the telemedicine practice guidelines say that we can use the telemedicine for number one, health education, things like diet advices, advice on exercise, advice on healthy lifestyle, advice on vaccination. If this is there, then we can always give contraceptive advice also as a part of health education, counseling about specific health issues, and prescribing medicine. So when we look at family planning services, then advice regarding condoms and other barrier methods will come under this health education. Patient specific advice and the cafeteria approach will come under counseling. OCPs that we are going to be prescribing will come under the prescription, and this prescription can be directed directly to an online pharmacy and it can be delivered to the patient. Say injectables can be given, like a DMPA can be advised on telemedicine and the injection can be given by some healthcare worker at that end. And when it comes to IUCD, though, insertion would need an in-person consultation, but continuation of an IUCD, like somebody may have finished her 5 years of an Mirena today, and we can always take a call whether now she has to come back to remove it, or maybe she can continue using it for the next 6 months, because we know that though Mirena, they say that the expire is 5 years, we can keep it for more than 5 years. So these calls we can take and we can give this advice on telemedicine platform. Now the next question is, can we use artificial intelligence for giving health education on contraception and for giving contraceptive advice? At this moment of time, artificial intelligence is excluded from the guideline. But just because it is excluded from the guideline doesn't mean that it is not allowed. Eventually, the Board of Governors of MCI will think about it and they will include that also after having gone through all the nuances of an artificial intelligence. So for Foxy, it will not be difficult to convince the Board of Governors to include AI for contraceptive advice. And I think even if you are going to use something like a platform like Tanu, and even if they are using an artificial intelligence for that, it is going to be allowed and you have to just talk to the Board of Governors of MCI. Now, which mode and which digital platform can be used? The answer is simple. All modes, any digital platform, all modes, audio, video, text, digital data exchange, everything is allowed. And anything that you can think of in digital platform, telephone, mobiles, landline, WhatsApp, mobile apps, Facebook messengers, video devices, all that can be connected through internet is allowed for using your teleconsultation. Is explicit consent required before we give any contraceptive advice on the telemedicine platform? Because this is what we'll have to address. Now, if the patient is initiating the conversation and patient has come on the platform, say on Tanu, to ask questions on us, then the consent is implied. It is only when we are reaching out to the patient and giving an advice and explicit consent is going to be required. And that too is not a written consent on a consent form or something like that. Even a text or an email on the digital platform saying that the patient gives consent to you for this particular advice is good enough. Is there a specific format for prescription? And the answer is yes, there is a specific format mentioned in the telemedicine practice guideline. And this format is a typical, you can go on the MMC website, the Maharashtra Medical Council website, and there is a wonderful format for prescription. So many of the platforms are formatting their prescriptions as per the specification on the site. And this includes patient's age, the other details of the patients, the registered medical practitioner's details, including the registration number. These are certain points that they feel are important to be there on the prescription. No list of drugs that can be prescribed. And whenever there is any presentation on telemedicine to you by any forum, they show you all this list of drugs. But you have to understand that this list is going to get updated from time to time by the Board of Governors. So even if they say whatever the list, eventually you will have to remember only the last one. That is the prohibited drugs. These are the narcotic drugs, psychotropic drugs, anti-cancer drugs. But I feel even these drugs should be allowed to be given on the telemedicine platform guideline, because if there is somebody who needs advise on the telemedicine platform, then it is the psychiatric patient. And if there is somebody who needs an advice on telemedicine platform, then it is some patient who's taking chemotherapy and to be connected with her own doctor who may be a medical oncologist. But then advocacy is going to be needed on this. All we need to now know is these three list of drugs. List O is all your OTC drugs, paracetamol, cold cough drugs, Imatinix, everything. And it also includes public health drugs. So if supposing during malaria, chloroquine is to be given, some vaccines are to be given, all this is included in public health drug. Contraceptives like barrier and OCPs can also come under the list O. List A is relatively safe drug list, which can be given by a first video consultation for drugs on skin, eye, ear. You can have a look at the patient on the video or on the on an image, and then you can give the drug. So these includes those drugs, and it also includes follow-up, refill drugs of any mode. Like a patient is hypertensive, diabetic, patient is asthmatic, and every now and then you have to give a prescription of the drugs that can be given, and that is included in list A. And list A can also include an OCP or a DNPA. And list B is relatively safe add-on drugs. You're already treating the patient for something. You've done an in-person consultation and patient sends you a report, and as per the report, you want to change the drug, that can be included. So you have to understand whenever you are giving any prescription, under which list you are giving the prescription, so that medico-legally you can be safe that you have given this drug under list A or under list B. So that is what you need to remember when you're prescribing. And when it comes to contraception, I think you're very safe and there is no problem in prescribing any contraceptive. Now, before prescribing OCP, we usually would want to check her blood pressure. Then does that mean that OCP cannot be prescribed on a telemedicine? The answer is no. The blood pressure can be checked with now the blood pressure machines if the patients are educated enough, or somebody, some healthcare worker at the other end can check her blood pressure, and you can even prescribe an OCP on a telemedicine platform. What about teleconsultation, whether it is allowed in emergency? When it comes to an emergency, the guidelines tell us that you are not supposed to give any prescription on emergency, but those prescriptions can be of drugs which are needed in emergency. Like somebody is talking, telling you about symptoms which you feel are maybe of angina. And if you tell him that just to tide over the situation, if you say that you take aspirin, you take your drugs which are going to be helpful for angina, that is allowed. Like if supposing you get a phone call and if you will feel that she's a case of an ectopic and you feel that she will need a surgery immediately, you can always advise don't eat anything, BNB, things like that can be given, and then you have to direct the patient to a proper hospital. What about emergency contraception? Emergency contraception will be allowed to be given on teleconsultation. Now, can you give contraceptive advice as a first consultation? We always say that first of all, you should have seen the patient with an in-person consultation, and only then you can give the drugs on a follow-up. Now, the guidelines say that first consultation is allowed only, it has to be a video consultation or an image, and it is only about video opinion on eye, skin, or ear condition. And the gap between the first consultation and the second follow-up consultation, the follow-up can be a telemedicine consultation, is as large as 6 months. So we are lucky. Even after 15 days, after 1 month, after 2 months, you did a follow-up consultation on telemedicine, you are going to be protected legally. However, as a medico-legal expert, I would always advise that there has to be a reasonable time between your telemedicine consultation and your in-person examination of the patient. For other cases, for contraception, I think we need to do a little bit of an advocacy, and I think Jaydeep will take it up, and we'll have to talk to the board of governors and include not only eye, skin, and ear condition, but include even contraceptive advice that can be advised on first consultation without ever having seen the patient in person. Some legal queries: what standard of care is expected while doing a teleconsultation? Same as what is expected when you're doing an in-person consultation. However, the guidelines are careful enough to mention that the courts are supposed to understand the limitation of a telemedicine consultation while judging a case of teleconsultation. So the guidelines have given some advices even to the court, saying that this is a teleconsultation, and in teleconsultation there is no in-person contact, and there are going to be some limitations in the consultation. So the standard is expected to be same. What about confidentiality and privacy? Whose responsibility? The responsibility is on us, the doctors. So we have to choose our platform properly. You choose only that platform which is going to take care of your the privacy and confidentiality of the patient. However, again, that guideline has been mature enough to say the responsibility, if there is some breach in the confidentiality and privacy because of technical snag on the platform, the doctor is not going to be held responsible, and it is the platform which is going to be held responsible. So the guidelines have been good for us. So which are the mandatory documents to be mentioned? These are the log of telemedicine interaction, the patient document, the prescription record. All these things are supposed to be maintained by us. What points are excluded from the TPG? I told you at this moment of time, artificial intelligence is excluded. Similarly, there are certain things like specification of hardware, software, data management system, all that has been excluded. Thank God. So now we can use whatever we have with us. We can use our own software, we can use our own hardware to do the teleconsultation. But time will come when they will have some specification on this. They have not yet dwelt with how to use telemedicine for research activity. They have not yet dealt with how to use telemedicine for consultation out of India, and they have not yet touched upon using of digital technology to conduct surgical or invasive procedures. So robotic and other things have not yet dealt with. So these are the things which are excluded, but excluded doesn't mean that it is a permanent exclusion. Eventually, because they had to come out with these guidelines in a hurry because of the pandemic, that's why they have kept this aside. They have parked all these problems, and eventually they're going to think about this also. So what is considered to be a misconduct of telemedicine? This is what we need to know. If we want to use it legally, we need to know what is misconduct. The misconduct is if the registered medical practitioner is insisting on telemedicine when the patient is not willing. So how
Hello. Hello, Javed. What is happening?
Ma'am, just allow me a moment, just 1 second, ma'am.
It was going extremely well. So,
Understand? Ma'am,
hello. Excuse me.
still live. Dr. Dileep, there is a technical error. Ma'am, please call. We need to contact Dr. Dileep.
And
hello.
Yeah, he has to rejoin or something, Javed.
Yes, ma'am. Yes, ma'am. He has to rejoin.
Okay, I'll tell him.
Yes.
Javed, even your signals are not very good.
Okay.
Can you do anything about it, Javed? We are still halfway through.
Ma'am, just give me 2
Yeah,
minutes,
you
ma'am.
should have.
Once Dr. Dilip joins, everything will be perfect.
Hello. 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 Yeah. Please connect. Please connect. Yeah. He said he is connecting again. So has Dr. Alpesh joined? Hello, Javed?
No, ma'am. No, ma'am. No, ma'am.
And Dr. Shanta also?
No, ma'am. No,
Not
ma'am.
yet?
No, ma'am.
Oh, that is sad. I was hoping for both of them.
Yeah, Dr. Dilip Valkesar has joined.
Yeah, okay.
So shall
Then
I
we
start?
can- Yes,
You-
please, Dilip. Please.
At what point were we stuck?
Yeah, we were at exclusions.
We were at exclusions. Okay.
One
can you
slide
see
after the exclusions. Misconduct. Yeah, misconduct.
this was what we were talking about?
Yeah, misconduct. Yeah.
Okay. So I was talking about what are those points wherein we are going to be considered having done misconduct on telemedicine platform. Because we need to know this, because otherwise we will be caught up in the legal issues. Number one, the registered medical practitioner insisting on telemedicine when the patient is not willing. Suppose the patient is not willing to come on the platform like Tanu, and you are insisting that she should get the advice only on Tanu. That is not allowed. A registered medical practitioner misusing the patient images and data on social media. That is not allowed, absolutely. Or prescribing medicine from those prohibited lists. And I am sure that prohibited list is now going to become eventually smaller and smaller, because everybody is going to do some advocacy. The oncologist will do some advocacy with the board of governors. The psychiatrist will do some advocacy with the board of governors. And eventually those are also going to be allowed. But definitely soliciting telemedicine through advertisements or inducements will definitely not be allowed. And that is what we need to remember always. So eventually, I was coming to my last slide only. Eventually, what it means, and I don't think I should be talking a lot about private platform provider, because that is not the agenda today. But some other day we can talk about how to choose a good private platform provider. However, in one slide, you have to choose a platform provider which is not only giving you a mobile app but a website support also, and avoiding, so that you can avoid social media platforms like a WhatsApp and other things. It should support your audio, video, chats, and document record exchange. It should store the data or anything that is happening between you and the patient in an encrypted form, and that encrypted form can be decoded only by one or two members in the private platform providers, and those members should also having a non-disclosure agreement with you. There should be an easy identification of doctor and patient with all details, and patient details and doctor details also on the platform. Medico-legal safety for doctors with clear disclaimers and consent should be there on the platform. There should be a secure payment gateway to monetize the RMP. After having given the advice, whatever are your charges, and they should have this system of also charging zero. Like supposing you had seen the patient in the morning and the patient is getting connected with you on a telemedicine app in the evening, and you do not want to charge, there should be some way in which you can give the advice even at a zero charge. From zero to whatever, you should be the platform should be able to provide you. Prescription for simple medication drafted as a ready-made template with provisions for doctor's signature, so that it is authenticated properly. Your signature, your stamp, and a single printout option should be there. So we can use it fearlessly while using our judgment as to decide whether this advice can be given on telemedicine or whether you need to do an in-person consultation. Just to end, I wish to give a punchline for the Foxy Family Welfare Committee to 2020 when it comes to telemedicine and use in contraception. The punchline can be, you can tell your patients, do not commute to communicate for contraceptive advice with us. So that is the way we can reach out through Tanu with all our clients. Thank you very much for patient listening, and I am ready to take any questions later on. Yeah.
Yes, thank you. Thank you so much. Thank you so much. Yeah.
Let's stop sharing now.
Yeah. Yeah. So can there be some question answer session now? Has Dr. Alpesh joined, Dr. Javed? Mr. Javed?
No, ma'am. No, ma'am. No, ma'am.
And
No, ma'am.
Dr. Shantakumari? No.
No.
So anyone wants to share their experience of teleconsultation here, or shall we go ahead with the next presentation and take the interaction part later? Shall we go ahead so that we complete the set of presentations and then we have interaction?
Yeah, sure.
So okay, thank you, Atul. So let me share my screen now. Javed, I'm sharing my screen, and let me finish my presentation.
Sure, ma'am.
Just a minute. Sorry about that. Yeah, here I am. Yeah, so that is me. And at the outset, I must again thank all of you for being present here. And let me just finish this, and then we shall speak we shall talk about this entire service in detail later on, when Dr. Jaydeep also has given his inputs and Dr. Ganatra also has spoken about it. Well, my duty today is to introduce a few points about Ask Tanu and also about the current situation in the pandemic, which has not allowed women what they are rightfully due, and that is counseling and health education on contraception. That is what is their right, fundamental right, but it has been denied because of the pandemic situation. Well, this is an effort from Foxy to introduce the thought of an AI-based chatbot. Maybe to take fruition, to come into practice, it may take some time, but we thought this today was an appropriate day to talk about this, to launch this, and this is called Ask Tanu. We are supported well by the industry partner Bayer. It is actually their concept which Foxy intends to take, modify, and then implement. A few words about contraceptive usage and the unmet need, and I need not re-emphasize here what every one of our August audience already are aware of, that we stand today at a total unmet need of 13% or so. It hasn't changed much in the past decades, and by the NFHS Survey 4. The results of the NFHS Survey 5 are shortly expected, has been a little delayed due to the pandemic, but whether we look at a better contraceptive usage coverage, it remains to be seen. Right now, what we are aware, a little less than 50% is the modern contraceptive usage, and amongst them, still the permanent methods share the most of the choices, whereas the pills, the barrier methods, and very sadly, the IUCD, PP-IUCD still remains at less than 5%. Which is actually very, very disheartening, because a lot of good work is being done in this field by our Foxians, but still a lot remains to be done. Well, this is the incidence of teenage pregnancy in India is about 8%, and this has seen a decline in the past 2 decades, but then a lot more needs to be done. This is a state-wise breakup, and I don't think we should dwell on that. This is the unwanted fertility rates which can be which need to be averted in order to reach the replacement level fertility of around 2. This has already been reached in some states, but a lot more needs to be achieved. Okay, so when we speak about high risk births which result because of non-availability of contraception, today we must understand them in terms of too close pregnancies, too many pregnancies, and too early pregnancies. The last one, too early, just now I have mentioned, is about 8%, where they are in the age group of 15 to 19 years, a real pathos, the real tragedy for any society to see young girls becoming pregnant. And 8% of our population is, of our teenage population, is a high number, because we know today that 30% of our citizens are youth or adolescents. Too many are when 22.8% are third or more order births. A lot needs to be achieved, and too close. This is very disheartening. This means that unmet need is still at its peak in the first year after birth, the most sensitive period, when it actually needs to be the lowest, because our service should be that strong to promote postpartum contraception. 48% of births have birth interval of less than 36 months, and this is the data which has the maximum impact on the health of our mothers and neonates. Okay, I think I must go on emphasizing that at the time of pandemic, this is global data that 47 million women in low and middle income countries may be deprived of modern methods, resulting in 7 million unintended pregnancies, and at least 15% of them will be in India. Method-wise loss of contraceptive services, it's published data already by the esteemed NGO FRHS, the Foundation for Reproductive Health Services in India. And we all need to stand informed today that sterilization services have been deeply impacted. So also has been the issue of pills and condoms, even through the ASHAs, not only in the private sector, because ASHAs are also multitasking tasking with the COVID duties. The provision of family planning services, therefore, is impacted, as I have already said. And these are some more, authentic data to say that there is a 36% reduction in the injectable contraceptives, which is very, very safe in these times and can be easily provided by the nearby technical person, the nurse or the paramedic, etc. And we can easily give the prescription on teleconsultation. 26 million couples in India are already facing the unmet need of contraception already, and we need to reduce this number by leaps and bounds if we can have to make any difference to the reproductive outcome in the next 1 year. And we all know COVID-19 has devastating effect on women and girls, and it really is adversely impacted the health of women whenever there is reallocation of resources and priorities of this magnitude, and that will include the SRHR services. So the contraception, already there are some publications stating that telehealth for counseling and screening, we need to counsel for prescribe for COCs for appropriate users, provide additional counseling information. So method initiation, method continuation, everything is possible on telemedicine, and long-term prescriptions are also possible. Refill of prescriptions. We have spoken to some extent about this. So the role of counseling and health information in contraception cannot be done only by the specialists today. We do need additional platforms. We also need to understand that choosing a method is not a one-size-fits-all decision for women. They are looking for different things when they opt for contraception. Today, they are better informed, they are more empowered, they have kind of better ideas how to conduct their lives. And the working women in India, especially the middle class and even the lower middle class, is a microcosm of an industry in herself. She is multitasking from morning till night, right from her commute to work and the food preparation before that, and the taking care of her elders and children and her husband in the family. Everything has to fit together in addition to her own health needs. And for that, we understand that women can have different needs and different expectations from family planning methods. Some of them want it to be highly reliable. Others may want a very low dose of medication, may want less expensive options, may want protection from infection, and may want spacing. And most important of all, they want it to be very, very safe and free of side effects. 60% of women, therefore, are very interested in hearing about other methods. This was a study based in European countries, a TANCO study. It shows that the healthcare providers thought only 46% women would be interested, less than 50%, whereas it is a much higher number who are looking for our advice and our counseling. Underestimating women's interest may limit the sharing of information. So what the message I need to give in rather than reading out this heavy slide is that there is a need today to increase the conversation on contraception. Let us talk more contraception. I think there are many vice presidents here today, all of them, and we all have seen in the past 1 decade how the concept in women's mind and women's society, the concept of menstrual hygiene has changed. There was a time when there was a lot of hesitation talking about options for menstrual hygiene. But today it is so much in the open, and everybody speaks about green the red revolution, and everybody speaks about eco-friendly options and menstrual cups. The same kind of revolution, the same wave has to come for contraception conversation, and that is when we will achieve a better atmosphere for women to access it without being judged about it. So quite a few women are worried about side effects, and there are discontinuations because they can't talk about it. There is a hidden dissatisfaction, and 80% of women discontinue or switch to a less reliable method because nobody spoke to them about continuation and reassurance. There are some more data to that effect. I think suffering in silence can have a significant impact on women's lives. And we as care providers should see that this number comes down. 8 out of 10 women report feelings of reduced confidence and attractiveness when they suffer from menstruation related symptoms and lack of contraception services. Indian families are more guided by the advice of elders, and therefore our counseling has to be a bit more holistic and has to include the male partner and sometimes the in-law. This chatbot, which we have made an endeavor to explore the possibility of making it available for our Foxians, is a Facebook and AI based at present for health information and health education on contraception, and it can be regarded as a slightly higher version of a social information media. It provides women with health information and education about contraception. The robo is called Ask Tanu, and it is easy for clients to type their questions and receive an answer. And we are planning to enhance the information available on this. So far, it already caters to questions like how effective are condoms, about some answers about STIs, about some side effects, about impact of methods on fertility, how and which contraceptive pill to choose to some extent, when to stop taking the pill, what to do when she misses the pill, what are the side effects, etc., and how reliable a particular method is. So she comes across to say that she is Tanu and she is the new best friend for family planning. Well, we could change this BFF if it's not comfortable for us, but then that is what it exists as. She says, rest assured, this is a private chat. And in case the client doesn't want to continue chatting, she can delete the conversation and disable the messages. To complete confidentiality, there is no coercion, as Dr. Valke repeatedly said, and there is absolute freedom to either go ahead or stop. Ensure complete data protection and privacy. Just remember, I am not a certified medical professional, but I can give you good guidance to see one. Please do read the disclaimer to know more about the scope of information I can share. So we are going to modify all this to a more acceptable form for Foxians. By clicking I agree button below, you consent to us processing your personal data, including sensitive personal data, are some of the requirements for the client to enter into this chatbot. Well, with that, I end my presentation, and I require Dr. Tank to come forward and give his input, and as well as Dr. Ganatra and the other vice presidents as to what they think about such a service and how best it will be used by Foxians, and how can we introduce this to reduce the unmet need.
Thank you very much, Dr. Shobha Goody, and thank you also for taking this initiative for this chatbot. I do look forward to hearing the Vice President's views on yours and Dr. Dilip Valke's presentation. It is, of course, now, has been said repeatedly, is the era of computers, is the era of artificial intelligence. And I think this is an excellent way of leveraging technology to reach out
Dr. Alpesh is not come. Okay.
young people.
Okay. When he comes, you please tell him. Okay.
But as I had said, we have to explore the ways to make sure that we are indemnified from the end results of those who follow this advice, and we have to find a way of making sure that the script which the chatbot uses does not contradict Foxy's known positions on contraception and other family planning issues. So to that end, I have already requested you that you should try to get hold of that script, which is used by the chatbot, and bring it up to Foxy standards. And then we will have a proper MOU with proper understandings, and then proceed on this. So all the best,
Doctor.
And as I said, I think Dr. Shantakumari has now joined. So we look forward to hearing the views of all the vice presidents and Dr. Shantakumari. Thank you. You're muted, Dr. Shobha, you're muted.
Thank you very much, Dr. Jaydeep. I thought you will be a kind of more elaborately about the chat on what all we discussed the other day. Any which way, that will come up in the conversation. I extend a very warm welcome to the President-elect, Dr. Shantakumari. Thank you so much for joining. Thank you very much. Javed, can we have her CV so that Dr. Atul can introduce her
Yes,
to
ma'am. Yes.
the
Yes,
audience and to us? Yes, please share her
Yeah.
CV. Yeah.
Dr. Shobha, if you could please excuse me, I have to go for another webinar. I was supposed to go there at 5, but I stayed back till your presentation.
Thank you, Dr. Jaydeep. Thank you very much for your input.
Sorry, Shanta, the vice president, I have to leave, but I must go and join there. Otherwise, they will get annoyed.
Yes, Jaydeep.
Yeah. Thank you very much. Thank you.
Well, it's an absolute honor to introduce the dynamic lady from Andhra Pradesh, Professor S. Dr. Shantakumari, who's a very, very dear friend, philosopher, guide. I think she'll soon become the Chief Minister of Andhra Pradesh. She's only the President-elect right now. But knowing the way she is progressing, coolly sitting there and having a cup of coffee. So basically, as of now, she's the President-elect Foxy 2021. And I think all vice presidents sitting here are hoping she becomes the president soon. Services in Foxy, Chairperson Foxy ICOG 2018, member FIGO Working Group, Vice President Foxy 2013, IAG Managing Committee member 2015 to 19. Lots and lots of award. Of course, the very, very prestigious FRCOG Honoris Causa in 2018, FRCPI from Ireland, ICOG Secretary 2015.
Thank you, Atul.
And very often I tell a lot of people that she is world famous in India, but Dr. Shantakumari is truly world famous in the world. Welcome, Shant.
Good evening, everyone. Atul wanted me to have the nice laugh of today. So thank you, Atul. That is Atul. We share a very close friendship. I'm very fond of Atul. Well, friends, we have just heard Dr. Shobha. I think I should congratulate the Family Welfare Committee and Foxy for this very, I don't have the perfect word, but I think in these days, this is the much needed services to be rendered by Foxy. Contraception is something we need to actually start talking about. And what more incentive than you need rather than our own Prime Minister when he started talking about contraception in January on the Republic Day, I think, or in this, and one of his Mann Ki Baat also. That shows the commitment of the government for contraception and the need for all of us to actually talk about contraception. In fact, Atul, very nicely you put it all around the globe and everything. Yes, I enjoyed my travels with FIGO and Foxy. And what I've realized that being in India is the most luckiest thing which could have happened to me or any other woman in India. We Indian women are more empowered than many other developed countries. So if you go to the West, you go to America, you go to some places in Europe, you go to South America. Let me just tell you an anecdote. We were invited for the FLASOG, the Latin American Societies Congress last time, and this year because of COVID, it's deferred. So I wanted to do the No to Violence Against Women march, and we wanted to convey the importance of contraception, then how women need to say no to violence It took us 6 months to convince the Latin American men, I should say, they're all gynecologist men, to accept this proposal from Figo's side and from my side, because they said they were giving every excuse not to have it. And the reason was they were worried about the political onslaught. And finally, when I persisted and insisted, finally they agreed, and they said, yes, we will have an press meet. And let me tell you, on the press meet, there were a lot of press people. Everything was going on in Spanish, but on the dais, it was full of all the members, but not a single woman on the dais. And they were talking about women's rights, contraception, and everything. At the end of the press meet, when I put my foot down, they said, okay, now you all can talk. They put me and another 3-4 Latin American women and went. Of course, I was speaking in English and there was a translator. I don't know whether they translated what I was telling correctly. That is the fate of the gynecologist women also in some of the countries. Because people, the political will and the association are not very keen on advocating these very important issues of women's health, that is contraception, abortion, for safe sexual and reproductive rights of any woman. So that day I realized how important and how wonderful we women in India are. We are very lucky. Yes, we have different stratas. We still have illiteracy and so many other issues. But I'm sure that very soon that we will be overcoming all that. And this digitalization is a fantastic means where we can reach out to the masses, because of that. This will cut down the sort of inhibitions between the person who wants to actually access the services. So I think this is the best thing which we would be doing for women's health. So all the best. And I have a small point. I think along with the female contraception, when we are talking, I think we need to keep on talking about the male contraception and how it's the responsibility of male to actually be an active partner in these family welfare issues. So that is one thing very important that we should be doing on the virtual media. And Atul, I think you should take it up we should take it up in a big way and try to convey our message across the country.
Yeah.
I don't leave any opportunity to do nasbandi on anybody.
No, it's not. I agree
Absolutely.
with you,
No.
but
I
the
think
thing
counseling,
is,
absolutely.
people are not talking. I think I would like to request our Prime Minister, and the Health Ministry. Now, of course, because of the COVID and infection, unless we talk that yes, male contraception is as important, or I should say more important than the female contraception in moving forward. I think that is the most important.
Absolutely.
Spot on.
What a wonderful message by the President-elect. In fact, I think world over the societies are patriarchal. It is not only in India, and men have the agency. And we either need both to create an agency for women and also to enforce that men use the agency constructively for family planning. Well, any
Shobha,
other
one small point I have to tell. Honestly speaking, Indian men are also much better than, of course, we can't generalize, the majority of them are very supportive of these services. So, and we hope 100% we get them to okay for the services. That's a small.
Yes. Yeah. So there has been some discussion on the chatbot already. And Dr. Jaydeep has already told that we need to have a disclaimer in this. We need to have some way of having an indemnification so that we are legally safe while providing advice. We need to enhance the content of this. A lot more variety of information has to be fed in. And also, I think we need to close the loop wherein we can tell the clients that after a particular stage, they need to consult a gynecologist. And whether, we need to link it to a consultation platform, these are the questions which still need to be sorted out so that the client who visits the chatbot does not have to worry about, whom to approach. So that is how we intend to take this service forward, and it will be very interactive and a lot of doubts can be solved. And if a team can be built to give the service of chatbot, I think it will be a wonderful thing to for all Foxians to use this source in order and inform their clients about it, whoever approaches them, so that it becomes like a chain reaction, and the conversation on contraception will increase tremendously. That is the basic idea behind this. And of course, it will lead to women empowerment, because they can get access to very, very expert advice very easily. So that is what, and it will lead to more take up of methods. That is the basic thing. Now, I wanted to wait till Dr. Alpesh came. Any chance that he will join? He's still not answered
We
his.
should just go on. He will join whenever he is able.
So the next thing on the agenda, apart from the questions, was I think I did have some discussion around teleconsultation with Dr. Walke, but there is an important step here that we need to take the pledge, since all the vice presidents are here with us today. So we need to take the pledge, and since I wanted to wait for Dr. Alpesh, so Shaijas, how about we play the video that you have made first, and after that also, if Dr. Alpesh has not joined, then we'll take the pledge with Dr. Shanta telling us to take the oath. Dr. Shaijas? Has he logged out, Javed?
Yes, ma'am. He is just logged out.
Okay, then you can call him to join back
Okay.
again. Meanwhile,
Sure,
I
ma'am.
think, Dr. Shanta, we just now heard Dr. Walke on a very wonderful, subject of teleconsultation. And I just wanted to ask him a few questions on that. One is that when we are prescribing, Dr. Walke, do we need to mention the category under which the drug comes? Do we need to say this is, yeah?
No, it's not needed. All that you have to do is just give the prescription. Only thing is join a platform provider where the prescription can be authenticated. I mean, just giving a prescription on a WhatsApp and a written thing is not a prescription. It has to be in a proper format. And there should be some provision for you to sign the prescription. On an Android phone, it is very easy to sign the prescription. And there should be some provision for your stamp to go on the prescription directly.
Okay.
Now, I had a talk with all the people, the stakeholders, some of the board of governors. And the problem is, supposing we are not talking about contraceptives. Supposing if I were to give 10 tablets of Restil as a prescription to someone. Now, on a mobile, I can take a screenshot and I can get 10 printouts of those Restil tablets. And then eventually I can get 100 tablets of Restil, though the doctor has given only 10. This they are trying to see to it that this can be solved. And one thing that we came across after the discussion is there we can have a barcode on the prescription, so that when it goes to the pharmacy will read the barcode, and the barcode, once the tablets have been prescribed and given and dispensed, then the next pharmacy will not be able to read the barcode as such. So because that barcode will read that the tablets have been dispatched. So these are the things that even the board of governors are trying to improve upon. And it is only when we discuss such things on such webinars and we give our inputs through Foxy to them that things are going to improve. But when it comes to contraceptive prescriptions, I think there's going to be no issues, but it has to be in a proper format and it has to be authenticated with your sign and stamp. That's all. You did not mention which category.
Which category? Yeah. So right now, the personal experience is that we are going for teleconsultation through the hospital where we practice. Yeah. So they are managing. So that means that they are following the guidelines, right? Yeah. Even when. Yeah. But suppose a consultant wants to do it on WhatsApp, then it is not. We cannot write a prescription, click a picture, and then send to the patient. That will not be legal.
Because number one, you have to maintain all the records. Now, supposing you gave a prescription today on WhatsApp, now are you going to maintain all that forever? So here, when you're using a platform, what happens is they have their own cloud or they have their own servers. So everything that is happening between you and the patient, even if you have deleted it later on, will be there on the server forever in an encrypted form. Yeah. And they will be able to decode. Only one or two people in the platform provider will be able to decode it. And there's going to be a non-disclosure agreement between you and the provider. Okay. So even after 5 years, you want to ask your platform provider कि मेरा इसके साथ क्या हुआ था consultation, ये मुझे retrieve करके दो. He'll be able to retrieve it for you. When you're using emails also you tend to delete. Even WhatsApp you tend to delete. You will not be able to store it forever like that.
Okay.
So I always say that you need a private platform provider, but you choose them properly.
Okay. So you are insisting on a private platform provider. You are insisting on some kind of an electronic medical register to say.
Yeah.
No,
Because your
an
WhatsApp
EMR.
is also
It is
not,
more-
it's a social media after all. It is not
Mm.
leak proof.
Mm.
And then when you're using your own personal WhatsApp, then the whole responsibility of any breach in that is going to be yours. But if you're using a private platform provider, you're giving that responsibility onto somebody else. Though indirectly it is your responsibility, but at least you're seeing to it that everything is properly encrypted and the confidentiality and the privacy is maintained. Now, when it comes to data, data with anonymity of the name of the patient can be shared and should be shared, in fact. Otherwise, research will not happen. Like somebody is doing a prospective study, or then you need to have a data. Without data, we cannot do any study. So even the government is now dealing with all the private platform providers, even including us, and they're talking to us, wherein all the data that we generate on the platform with anonymity of the patient and with a by default consent from the patient will go to a common server to the government server, and government will be able to then devise all our healthcare facilities, our healthcare, whatever they want to do on in terms of healthcare. All those decisions can be taken on with the data that they have. So all the policies, healthcare policies, eventually is going to need all the data that we are providing. Now, when we are doing practice on in-person consultation, it is very difficult to pass on our data to the government. But here, telemedicine is one platform there. It is going to be very easy to pass on the data. So what I feel is not only we should use this telemedicine platform, but you should use this platform for your in-person consultation also, and everything should be there on through your website or through a software during the in-person consultation also. So even that data can be shared with the government without the name of the patient.
Okay. So you feel outpatient and inpatient both data should be? Yeah.
Ideally, yeah. Eventually, it is. I mean, there is a lot about the legal aspects about data sharing, and presently in our country, those laws and those statutes are not very clear. But eventually, when telemedicine will come, these statutes will become clear someday. Because data sharing is one big way of earning for the platform provider. Otherwise, the platform providers, it is very difficult to make two ends meet with the 10% that you take on the transaction fee. For them to survive, they need to do something. And the one thing that they do is either they approach some pharmaceutical company and take money upfront from them, and the pharmaceutical companies sell these apps to you free of charge. So that is one way. But that money is going to last for a year or two. But when the data is sold to some, like I sell the data of prescription to a pharmaceutical company with anonymity of the patient and with consent of the patient, that whether it is going to be allowed henceforth or not is one thing that will come up, because at this moment of time only the guidelines have come. The next thing will be there'll be some statute on the guideline, and eventually these questions will be answered. But for any private platform provider to survive and to make business, data sale is one thing that is going to be needed.
Okay.
What I'm doing as of now is we do not give any prescriptions on WhatsApp. We write down a prescription on a prescription paper
and a photograph.
Take a photograph, but we file that prescription in our own file.
Correct.
Yeah.
So
that is one way.
That is if and when the patient comes, goes back to them. Our only concern now is that we are expected to keep a duplicate copy of the prescription, which we have not been able to do because of the kind of volume that we deal with.
So when you give it to some platform provider, all this headache is gone. I mean, you can just give the prescription, and even after 10 years you want it, you get it. It's like
absolutely. That's what we do with indoor files, I think. Just put them on cloud.
So, Anita madam.
Yes, Dr. Atul. The second copy you need to give to whom?
To the platform. I mean, either you can scan it and put it on cloud yourself, or you can have one of your data providers or somebody who's doing your computer work can put it on cloud like you would do on your indoor papers. Now, what do you do for important documents today? You make a folder and put it on your desktop, isn't it? Whether it's your income tax return or your insurance papers or your LIC policies. Similarly, all these indoor papers can be scanned and put it on the cloud. because you need to keep them for 5 to 8 years, 5 years for income tax and 8 years for otherwise. So I think instead of keeping physical copies, for example, birth certificates.
Yes, it becomes difficult after long.
For example, my hospital started in 1951. We still have patients who come and say 1966 में delivery हुआ था, मुझे उसका birth record चाहिए. Now those papers are getting torn. So the easier we put them on cloud, it's much easier to retrieve those data.
Correct. That's what I meant by electronic medical register, that they will have a much longer retention period and retrievable, and probably for our lifetime and our patient's lifetime.
So whenever there is a discussion on a medico legal platform and people ask me how many years should we store our documents, I say if you are a youngster, you should not even ask this question. As a youngster, you are all with technology. People like us who are oldies, we can ask about, like, his hospital is right from 1951. He can ask about kitne din rakhu paper, because we were using paper. Abhi youngsters should not even ask this question. They should be now storing it forever on with the help of technology.
Yeah. There's one more concern usually, that there are two aspects of teleconsultation in family planning services. One is when to convert the teleconsultation into a face-to-face visit. So there's something which we always convey when we talk about teleconsultation. So
fortunately,
would you say that you come over to the hospital, it's not possible to give you service on the phone?
Yeah, fortunately, the guidelines have given the responsibility of judging whether this consultation can continue on telemedicine or not, and whether to call them for in-person upon us. So it is we who will decide that abhi mujhe ye patient ko in-person consultation ke liye bulana zaruri hai. So it is not, there is nothing written in your legal books that this you can and this you cannot. The judgment has to be with us. So fortunately, they were mature enough to understand that this a law or a guideline cannot guide anybody on this. The doctor will judge whether this consultation can continue on telemedicine, or this consultation you need to call that patient at any moment of time. You feel that you need to see the patient and you need to examine the patient, you must tell her that please come for an examination.
Yeah. So we commonly tell them that when women have menstrual problems beyond few corrective measures like tranexamic acid or meftalspas for pain, something like that, they need to come over. When we suspect an ectopic pregnancy, when we suspect pregnancy at all, that means failure of contraceptive method. And for emergency contraception, if we have provided, the woman needs to follow up on teleconsult. If the method has failed, then she has to come. If she desires an IUCD placement, she has to come. And most importantly, if she desires an abortion service, then that is something that can be done only with face-to-face consultation, with counseling and filling the form C, etc. And after that, the post-abortal follow-up can be done by teleconsultation. Exactly. So that one visit is needed.
Like Girija is one very good user of my telemedicine app, and Girija has actually devised templates for each kind of a problem that a woman has. She's got a template for recurrent pregnancy loss. She's got a template for abnormal uterine bleeding, and she sends this template to the patient on through the app, and the patient will fill all the history. So she's got the history with her stored on the cloud forever. So that is the way she is devising. I just provided the platform, and now she is doing all the innovations. And for gynecology, for our gynaec OPD practice, I think I'm going to take it up from Girija, and we can provide it to the whole Foxians, wherein these templates can be used for us to get all the record and all the history from the patient.
Correct. Something similar which I was thinking about, methods of contraception.
Exactly.
When we tell them that what is this method, what are the disadvantages, advantages, what should worry you, and where is it that you should feel confident that this method will help you. So in general, creating the medical eligibility criteria remains a consultant's prerogative for any method, for any situation. That is very, very true. But once the basket has been offered, the MEC has been established, the remaining counseling can very well be by counselors who need not necessarily be doctors. The method-specific counseling also can be by paramedical or by an artificial intelligence mediated robots like this, which in due course, Dr. Valke is assuring that will become accepted. as of now, we will utilize it for counseling only. Dr. Ramani has any inputs, and Anita Madam and Archana. I think Dr. Ragini is not there. We shall move on to the oath taking if once your inputs are there. Yeah. Yeah, Archana, your experience with teleconsult, and Ramani Madam, your experience with teleconsult.
I did few consultation, not many, and it was quite good experience because people took advance appointments, and then they come. But I had one or two problems as well, which I would like to share. Like, you have done one consultation, but then the patient keeps sending their records and the old records for the whole month. How really you tackle those things? Because you have done one consultation, given them 15 minutes, the time, full time, and then you have seen all their reports, you have given them advice and everything. But then patient expects, I think expectations and what you're giving has to be set right. Maybe there is some way by which we can do it in beforehand only. I think
the best way, madam, is for everything that she's sending, you charge her for your advice. Like, she's sending one report, after 2 days, whatever advice you want to give on that report, you charge her for that. So once you start charging, she will learn her lesson, and she will not send you all those reports every 1 day, every 24 hours, one report. That she'll not do. That's what I do. For every chat, like in our app, what we do is, supposing a consultation is done, and then I devise a prescription. As doctor, I send the prescription to her. But the app doesn't show that prescription in a clear form. It is in that very blur form. And the private platform provider sends a message to the patient that unless you pay a doctor's consultation fee of 550 rupees, this prescription will not be visible to you. So the moment she pays that money, the prescription becomes visible. Same is with the chat. Now, supposing she asks you a question and you gave an answer. Before that answer is actually sent, the private platform provider asks you, so do you want this chat to be charged? And you say, yes, I want whatever, 20 rupees, 30 rupees, 100 rupees, 200 rupees. You say that, and that message goes to the patient, and the patient will have to pay that first and then see the chat. Or we can do it the way Uber does, wherein the patient will do the chat, and that money will be, that billing will be done. And the next time the patient wants to talk to you, first she'll have to clear the old bill, and only then she can. I mean, these things, I mean, there are very smart people. I mean, in my app, there are real smart people, technology guys who say, doctor, don't worry, we will take care of all that. They will see to it that your money will come.
Correct. Yeah. So, Ramani, Dr. Ramani Devi, yeah.
Yeah, I don't have much experience with this telemedicine, except that I just occasionally go for a video call and give them a message. But I think it has not become popular in our part of the city. Maybe some hi-fi group of people, especially those who are coming from Bengaluru, they are in the habit of calling for asking for a teleconsultation. Other than that, like Dr. Valke and Dr. Archana had said already, there are so many shortcomings in that. Suppose if I tell you that contraception, regarding contraception itself, you say, see, we need to go into the details of the history of the patient, whether, suppose we want to prescribe them some combined oral contraceptive pill, it is not uncommon to see some DVTs. We do come across that. But if you go into the history, they may not be able to give you proper thing. That is one disadvantage. And suppose even if you tell them to take a DMPA injection, which is very safe, they are reluctant. They want to see the doctor personally in our part of the city, and then only they want to go ahead with our further treatment.
Ramani Devi, Dr. Ramani Devi, today if she comes to see you with the face mask, cap and shield, she will not be able to see you. On Zoom, she will be able to see you better, I think.
Yeah.
So, but I've been doing a lot of teleconsulting because of Fortis Hospital. And what we do is we send the prescription to Fortis Hospital department.
Yes.
So after the patient is charged, we don't do it directly. After the patient is charged, the prescription is sent to them, or the patient pays in advance. So every consultation is routed through Fortis.
Yes.
So that's how we don't come into those issues. And I think, Archana, we tell our patients we give fee service, not free service. Remove the R.
That is actually it should always be a paid consultation unless it is a follow-up or it is something which you genuinely want to do because you know the family or the patient, etc.
Very embarrassing, madam.
Yeah.
Very embarrassing for after the consultation is done for us to tell कि consultation हो गया, मेरा 500 रुपए भेज दो Google Pay पे. ये नहीं हो सकता है. So that's the reason why if there is a private platform provider who does this embarrassing work for you before you write the prescription, you do the chat, everything is done, but that is seen by the patient in a blur form. And it is not the doctor who is saying pay money. The pay money part is coming from the company. And the company says pay the money, only then you will see the prescription. So that is the way we do it. Like even in video consultation, as Atul said, we do it upfront. I mean, the money is already taken. Patient takes an appointment for video consultation by paying your money. And only then you come on the video to talk.
But consultation, at least you save a lot of time of looking at the reports, because all this is sorted out by the staff at the hospital. You see the reports at your own leisure on the email. You know what the patient's history is. Take all the history, and when it comes to the examination, which she comes to the hospital.
Yes.
So I think that time, otherwise one new infertility patient will have 4 sets of files with her. By the time all those files are examined, it's an hour the patient is sitting in front of you. Unless you have 2 or 3 assistants or 2 or 3 cabins where these patients can be seen. Fortunately, most often I do that. I have 2 assistants who take history. I only do the talking, they write the prescription. The examination and the talking is done by me. The rest is done by my staff, my assistants. Otherwise, it is impossible to do the kind of work that we do. So it's, so that part of it can definitely be done by teleconsultation.
I think one thing is to begin with, we must all accept in our minds that teleconsultation is the way forward. And once we get used to the idea, it will all fall in place. Dr. Ramani, for you also.
Definitely.
It will fall in place.
The patients and send the messages through WhatsApp.
That is what.
And when my staff, they charge them subsequently, they all ask, see, just to talk with the doctor in the telephone, you need to have a consult. See, that is
that is their mindset. They feel that advice should come free. So that will have to change, and it will change. I'm convinced when the practices become uniform, everybody will accept it, because what they are saving is also their own time, their own money, and in transport. And the risk is getting averted for them. So I think they should be very thankful that they don't have to visit the hospital. Hospitals are places where one gets infection. So
maybe you can keep a clock on the teleconsultation video so that the patient realizes how many minutes she has spoken to you.
I'll tell you, Dr. Ramani Devi, when I introduced my teleconsultation app to Dr. Parag Biniwale, he was one person who argued with me. He said, no chance, Dilip, I cannot give any prescription to any patient unless I have examined. And today, Parag is one person who is the highest earner on my telemedicine app. Because now he started doing it. And now he's learned it, and he started doing his video consultation. So everybody eventually will fall in place, and they will start doing it.
Even antenatal care, I have found that it's possible to provide. A great deal of the time we don't need to examine, and you can call them for 2 or 3 visits. There is that 4-in-4 concept of the antenatal care in pandemic, where 4 visits are enough, 4 ultrasounds are enough, and 1 immunization, etc. That works very well. And I think Shaijas, can we continue the discussion later? Can you just, Dr. Shanta is there? I hope she has not logged out, because I needed her to give us the oath.
Seems to have lost the connectivity. She was here.
Yeah, we'll ask Dr. Shanta to log in back again. Can you please, Shaijas, introduce the concept of pledge and play the video, and after that there will be oath taking by all of us, and then we will disperse.
And we have the projection, Javed.
1 second, sir. 1 second.
Shaijas, you can introduce the concept also, because I had left it to you.
Yeah.
This is what
Dr.
we got.
Shaija's video.
Dr. Shaija's video.
Please play Dr. Shaija's video.
Bhanumati, can you play that video?
Share the screen.
Yes, I am playing that.
Concept credit totally goes to Shobha madam. I mean to say, within a short duration of time, I hope we could actually gather people to actually say this pledge and be a part of this wonderful, wonderful movement where people are pledging to ensure that they will promote contraception to prevent unintended pregnancies. So whoever could respond to us on time.
Javed, can you contact Dr. Shanta to log in? We have to take the pledge, no? Or Dr. Alpesh?
Just put it on full screen.
The full screen and just increase the volume also so that we can hear them well.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancy.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unwanted pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
Hello.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unwanted pregnancies.
I pledge to promote contraception to prevent unintended pregnancy.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
I pledge to promote contraception to prevent unintended pregnancies.
Yeah. Thank you, Shaijas. And
big thanks to everyone who contributed to this at a very short duration.
Something simple, but I felt it is important to kind of make a noise about contraception today on the eve of World Contraception Day. So I think it is difficult for to get either the president or president-elect. So I request Dr. Atul as my vice president to, read out the pledge, and all of us can join him. And probably by then, if there are no questions, we could. Yeah, Shanta has already left. Yeah. 1 minute. Hold it there. Just a moment. Dr. Atul, you will have to read out the pledge one sentence by sentence. So if you say I pledge, all of us will say I pledge, and then so on. Yeah. And our hands are like this. All videos. Yeah. Thank you. Thank you.
Shall all of us unmute ourselves, please?
Yes. No, but how will we take the pledge?
No, I told unmute.
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 Yeah. What has happened to me, Shaijas? I'm getting old.
No worries, no worries. This is a very common confusion for everyone.
Okay. Yes, please. Video, please.
I pledge.
I pledge.
I pledge.
To promote contraception.
To promote
contraception.
To prevent.
To prevent.
Prevent.
Unintended pregnancies.
Unintended pregnancies.
Thank you. Thanks to all of you. Thank you very much.
Nice program.
You can stop sharing. Something wanted to bring forth some talk, some conversation on contraception. And I think in the chat box, I can see somebody has asked which contraceptive pill is safe in modern times and why, so that we can end on a scientific note. In my experience and opinion, all contraceptive pills are safe. They have to fit into the MEC criteria for that woman, for that situation. Atul, what do you say? And Ramani,
absolutely. I will say what Dr. Nozer says. All pills are safe. Some women are dangerous.
Yeah.
So you have to identify those women and see to it that you don't give them those contraceptives.
Yes. It's a very, very clever thing which Dr. Sharir has kind of made us follow. Dr. Malini from BMC Bangalore, is injectable contraceptive allowed in teleconsultation? So yes. Dr. Walke, is it okay to write a prescription for
writing a prescription? The guidelines also mention it is not just between the registered medical practitioner and the patient. It is between the registered medical practitioner and a healthcare worker who's taking care of the patient also. So you can do a teleconsultation, make a prescription of, say, a DMPA, an injectable contraceptive, and some healthcare provider can then inject that to the patient. So that can be done. So ultimately, it becomes a teleconsultation. Yeah. Your staff nurse can do it. Staff nurse is considered to be a healthcare provider. So a staff nurse sitting there can inject.
And I think,
all contraceptives are safe, but not at all times. Especially in the COVID period, combined oral contraceptives are supposed to have some adverse effects. Suppose the patient becomes COVID positive, because we know the basic pathology is going to be the sort of thrombosis that is going to occur in all the vessels. So patient on OC pill with a combined oral contraceptive pill, there is a higher chance the thrombus that can get activated, and it can worsen the current situation of COVID positivity.
Would recommend everybody to read Professor John Gilboa's book. He's a genius on contraception. And in this statement that I made, all pills are safe, some women are dangerous, is Dr. John Gilboa's quotation. And I think there are so many such anecdotal quotes of Dr. John Gilboa. If you read the British Journal of Family Planning, the editorial book and the book written by him, it is just amazing. I think it gives you such wonderful tips.
Really? Should do that. And I think, Dr. Ramani, yes, if a woman is COVID-19 infected, and if she has been taking estrogen-based contraceptives, she will have to discontinue that and follow an alternative method, because she will have to get protected from pregnancy. But apart from that, progesterone-only methods are safe in the dosages that they are being used. So it will, even injectables are safe. But if a woman is having active infection in terms of problems, very symptomatic, then also probably we must look at stopping the hormonal pills. But there is not enough evidence to stop, but maybe safer to stop and go for the bridging methods like barriers, etc., if needed, because when she is sick, naturally contraception won't be needed for some time. So that is how it goes. Yes.
And one more thing is, what is the barrier that is existing in our country to prevent men from undergoing vasectomy?
Okay.
You look into the vasectomy incidence, it's so low, and it is supposed to be the very easy, comfortable procedure.
Yes.
But one thing I feel is our own women are against that.
I'm sorry, I need to leave for an urgent call. Dr.
Yes.
Shobha.
Thank you, Dr. Atul. Thank you immensely. And I think that will be the last point of discussion, what has been raised by Dr. Ramani. Does Dr. Walke have to say anything? Can we advocate on vasectomy
the only thing that I want to say is, in my family, I was the one who got my vasectomy done 27 years back. So then you can know that what are my thoughts about it. So whenever in a forum we are there, and whenever there are male gynecologists, please do ask these questions of how many male gynecologists have undergone their vasectomy, because males have this habit of asking all the female gynecologists, how many of you have done your pap smears? I mean, these questions the male gynecologists ask. So now you start asking all the male gynecologists. You can ask Shaijus, has he done his vasectomy? I mean, you should be open and say, like, I did my vasectomy, and there was a report from Times of India then 27 years back, who reported that here is one doctor, one gynecologist who's got his vasectomy done. So simple thing like a vasectomy is a breaking news. I mean, I was not very happy to be in the news just for having done a
for
vasectomy.
that reason.
Yeah.
I think, Dr. Shobha,
yes.
it is the mindset which has to be changed.
Yes, madam.
And the second thing is we are no longer promoting permanent methods.
That is what
Anyway, sterilization and vasectomy are out of question nowadays. And we must not promote those methods because, you know, the social structure has changed. Many things have changed in the society. So we should more concentrate on the temporary methods rather than promoting tube ligation and vasectomy. And this, I think, debate will not have a place in the future.
No, whatever works for a society.
Which comes up soon.
Pardon, Shaijas? Didn't get you?
There'll be a pill for the man who comes up.
Yes, the male pill. The male pill will come up.
Actually, we should look for that only.
We should look for that.
I can tell you, when I got my vasectomy, then the people who were dissatisfied was one, my mother, and then the Ayabai and the staff nurses in my hospital. All those people were saying, Dr. Valke, how could you do that? I mean, this is not done. You should have told madam to get a tubectomy done. So it is the female who are not very happy getting a
correctly
vasectomy
told
done.
By Dr. Ramani. It's the women who are against their men.
I was about to tell what Dr. Anita has said. See, I think in the current scenario where there are a lot of divorces happening, I do get a lot of patients coming for through the second husband. Through the first husband, they would have had one baby or two baby. As Dr. Anita said, I am also not for permanent sterilization because times can change. It is always the women should be motivated more for a long term. LARC should be the
LARC methods.
LARC method should be, because once when you put it, even it can be there for about 10 years. So at whatever time she wants to remove, reversal can happen. So that should be promoted rather than promoting surgical method of sterilization, which is not without complication and the cost that is involved for the government of India.
That's great.
I usually advise my patients to put in a Mirena 3 times in their lives. You put in a Mirena, remove after 7 years, put in another Mirena, remove after 7 years, put in another Mirena, 21 years, and you become menopausal. So then there is no need to do anything.
Yeah.
And she should at the same time have the satisfaction of getting pregnant anytime she wishes for.
Yeah, she can do
reversible.
And another thing is with sterilization, suppose if the patient has got an abnormal uterine bleeding,
that also is a benefit.
Do a sterilization, then they have to get inserted with an LNGIUS. That is another problem. So instead, like how Dr. Valke has said, I have patients with me who have inserted Mirena for more than 15 years.
Yeah.
It is quite comfortable, safe, and they don't bleed. Even for my daughters, I have
good quality of life.
Yeah.
Our doctor Shirish Patwardhan, who is so much for anemia.
Valke sir, you just opened up a new topic for oration where you will be the only one who will be eligible.
Okay.
The mindset leading towards a vasectomy and what followed.
Yeah.
Really great. So this has been a very constructive platform for discussion, and I'm very thankful today that POXI has been able to launch. So with the present vice presidents, I'm very thank you, Anita madam. Thank you, Dr. Ramani, for having been present. Dr. Valke's talk was, of course, excellent, and it is a little little sad that I could not get the residents to give us the pledge. It doesn't matter. Dr. Ganatra did a very wonderful job. So Shaijas, thank you so much for your support. And with that, I think it is time to take leave. And thank you very much for your presence. Thank you.
Yeah, stay safe, everyone.
Yeah, thank you.
Thank you.
Thank you, Dr. Soma.
Thank you, madam. Thanks for joining. And it is so useful to have a senior, gynecologist. You correctly said that we must talk more about spacing methods than limiting methods. It's a very important message to give. Thank you so much, especially in these pandemic times.
Thank you.
Thank you. Hello, Javed.
Ma'am, closing remarks.
Hello, closing
Yes.
lines. 1 minute, Ramani. Just a minute. Just a minute. I need Bayer to please don't leave, Dr. Ramani.
Yeah.
I need Bayer to say the closure. Yes. Javed, who is there from your side?
Yeah.
Don't discontinue with the audience, please. Yeah.
Right.
Hello.
Yes, ma'am. Yeah.
Yes. Thank you.
Thank you for session. So on behalf of Bayer, it's my privilege and I'm honored to thank all the panelists. Unfortunately, Dr. Alpesh could not be there, but I think it was very nice that Dr. Shantakumari could grace the occasion, taking out some time. And thank you so much to you, ma'am, for all the efforts and the back end, work and efforts what you put in, and also kind of, had a lot of encouragement for us also to initiate the whole collaboration. I would also not miss out to thank Dr. Jaydeep Tank. So even as industry partners also, we always try to look towards him for the guidance and direction what he gives. And last but not the least, all the vice presidents who were there, Dr. Atul, Dr. Anita, Dr. Ramani Devi. And of course, I'm not missing out on Dr. Dilip Palke for the wonderful talk and discussion. So thank you so much. And from our side, as Team Bayer, we'll be more than happy to collaborate and have a long association. So with this, thank you and have a nice weekend.
Thank you. Thank you very much, Deepak, for having, come forward for this collaboration. And we hope that we grow from strength to strength and we cross all hurdles and we make this a strong service for our women. Thank you so much.
Great. Thank you so much.
Yeah. Hello. Javed?
Yes, ma'am. 1 second.
You took some photographs, I hope.
No, ma'am. 1 second.
Now at least you people should come before Ramani madam leaves. We should take. I am taking one with Deepak and Ramani.
Yeah.
Yeah. You've taken a screenshot. Yeah. Thanks, Siji. That is nice. Okay. I will send with Siji, Upal. I wish all of you were there, but I have taken of others also, other faculty also. Yeah. So that was good. Okay. So that is a strong one.
We can, yeah, ma'am.
Yeah.
It was good.
Shobha, with your permission, I'm leaving.
Yes, madam. Thank you, Dr. Ramani. Thank you. Thank you very much.
Thank you so much.
Bye-bye.
Bye.
Bye.
Thank you.
Thanks, Dr. Shobha. Thanks a lot.
Thank you. And
Thank you so much, ma'am.
Yeah. And this some modification of content and all, we will start working on it.
Sure.
And I think we can start the service. I will just put a mail and find out how exactly we can float it to other Foxians. It's possible that we can start. Now, I just wanted to understand, is the entire thing mediated by artificial intelligence? Because it doesn't look like that to me in the form that it is there. Only the responses which are already fed in, maybe you have utilized the AI.
Right.
But it is not an automated thing, because there are a few standard responses and then Tanu says, sorry, I'm not aware about this.
Yeah.
So it's a very fixed content right now.
Right.
So whatever you have done, maybe you have sourced the AI, but it is not, what is that called? It is not an ongoing service. It's already pre-recorded responses.
Ma'am, the scripts are
wrong? No?
The scripts are pre-recorded. I mean, the scripts are done in a planned way. So anything other than, any other questions, then the Tanu tells that, sorry, I'm not, because anyone can ask anything, right?
Correct.
So if it tells that way.
Because if it was AI mediated completely, an ongoing AI being involved, then she wouldn't say that is what is my feeling. She would say that, she would source it from somewhere and give at least some information.
Yeah.
Actually, am I right?
Since the information that has to be given has to be authenticated. So what at the back end, what's possible to be done is that these questions, we come to know what are there, and then accordingly the new responses can be fed. So it's like an ongoing thing that
it is
can be
okay, but it
continued.
is still something which is already existing when the woman asks.
Yes.
It is nothing which can be generated at that time. So actually speaking, it is not an AI mediated app. So probably you need to remove that clause. Otherwise, by telemedicine guidelines, it may not be possible for us to incorporate in practice. That's what Dr. Valke said. No. So please get more technical input. Your technical team will be able to guide us. So in the next week or 2 weeks or so, let me hope for some kind of meeting, a sit down with your technical team, so that I understand these details better. I will also create a team of my committee workers who are interested in, this particular field of, improvising on this service. And with your team, let us kind of come to some kind of understanding as to, how this has worked so far. I don't think it is AI mediated. It's not an active AI mediated. If it is an active AI mediated, then it will not be, as it stands, it will not come within the purview of teleconsultation guidelines. All right. That's what he said, right? Because you can't source AI. AI would mean that, there is some computer brain which is giving you the solution of treatment to the clinical situation given as and when it is asked. It is not like that in your situation. For Ask Tanu, you have already recorded the responses after validating it, validating the scientific content with your scientific team. So it is different. Maybe to source that information, you might have used AI. So I want to be a little more clear about this, so that I can tell the central Foxy team that, okay, this is not, this will not be contradictory, or it will not be contrary to the guideline. Okay? I hope I made it. That is why I thought I will talk to you people before we disperse, because what Dr. Valke said, then, how to say that we are launching an app which is having AI, whereas AI is not approved by teleconsult. So that should not happen for us. We should not face that difficulty.
Yeah, that should not be an issue, ma'am. So we'll just get it clarified by tech. And what you say makes a lot of sense, I believe. So probably that can be sorted out, not an issue.
Okay. So it was great being today with Team Bayer, and the responses were good. And how many people logged in, Siji, if I may know?
Ma'am, 480 plus 80 people in YouTube. So 480 people logged in here. Okay, and some 80-85 people were watching in YouTube.
Very good. So for contraception, that is a victory. That is great for contraception. Okay, I had not hoped for about 500 audience. I was thinking 200 to 250, but it was good because I think that teleconsultation, talk was a good strategy, because it's very difficult to get people interested in contraception. For any which way, it has gone very well, and I must thank the whole team. You are really hardworking, and we shall see how best we can take this forward, make it highly scientific, so that consultants are convinced that good information is being given to their clients. Okay?
Thank you.
Thanks a lot.
Thank you, ma'am.
Ma'am, there's one social media post we wanted your approval for. So maybe Javed will just share that with you.
I'll share it in a minute, ma'am. I'll share it in a minute.
So it's based where in my mail or WhatsApp?
In your mail, ma'am. In your mail.
Fine. I will respond.
Okay.
Not to worry.
Yeah.
Sure. Okay. Bye.
Thanks a lot.
Thank you.
Have a nice
Bye.
evening.
You too.
Bye.
Gayatri, you can close.